Hey, so I get asked all the time, what is mindfulness? Because that seems to be like a hot word these days. Mindfulness this, mindfulness that. Mindfulness can help with chronic pain. Mindfulness can help with stress. Mindfulness can help with anxiety. And all of that is true, but I think because it's been such a hot button issue, or a hot buzzword, if you will, people start thinking that, well, mindfulness must just be a fad. And that's actually not true. Mindfulness as a practice has actually been around since, it dates back to Eastern traditions, but really as a medical practice or a psychological practice, it's been around since the 70s. And one of the first applications of mindfulness was actually in a chronic pain clinic. So there was a clinic up in Massachusetts where John Kabat-Zinn was teaching people with chronic pain how to practice mindfulness, how to practice the art of paying attention on purpose to one thing at a time without judgment. And what they found is that people who practice mindfulness had a lot better quality of life and a better sense of control as it related to managing their chronic pain. They also did this work with people who had cardiovascular disease and heart symptoms. And so really, mindfulness in terms of the mainstream practice was first brought in for people who had chronic medical issues. So it can make a big difference there. But it's been around for, 50 years now. It's just only now that we're really hearing about it more and more and more. So that's the first thing. Mindfulness is not a fad. It is evidence-based and it has been around for a really long time. The second thing I want to make clear is that mindfulness is not the same as relaxation training, okay? So a lot of times people think that practicing deep breathing is the same as mindfulness, and that's not actually true at all. I think people get into this misconception because a lot of times when people start learning mindfulness, we teach them to pay attention to their breath. We teach them to really stop and focus on one thing at a time, and that's usually the breath, because your breath is always with you. But with mindfulness, we're not necessarily trying to change your breathing. We're not necessarily trying to make those breaths deeper or even focus on the belly. What we're trying to do is give your brain something to anchor to, so that every time your mind wanders off and gets distracted by a thought, or every time you're starting to worry about what you're going to do later in the day, or anytime your pain starts to pull your attention away, you can pull yourself back to your breath, because your breath is that anchor. Your breath is that constant resting place. You're not really trying to change it. You're just choosing it as the thing that you're paying attention to. You could just as easily choose something else as the thing that you're paying attention to right here, right now, in the present moment. And sometimes when you practice a breath-focused mindfulness exercise, you might get a nice relaxation effect, just like you would if you were doing a deep breathing exercise. But that's a side effect. That's not the goal. The goal is training your mind to pay attention to one thing on purpose in the present moment. And that by doing that, by slowing the brain down, by choosing to focus on one thing at a time, that can help to manage anxious thoughts, stressful thoughts, getting distracted by pain and anxiety, getting distracted by thoughts about the past, getting distracted by worries about the future. It helps you to be present. It helps you to get the most out of the right here and right now. And that is how mindfulness can be helpful. So if you want to learn more about mindfulness for chronic pain or chronic illness, I encourage you to check out my website, www.beyondthebodypsych.com, and learn more about mindfulness and other approaches to managing chronic pain and chronic illness. I'm Dr. Jennifer Steiner, board certified clinical health psychologist. See you next time.